Hello everyone, welcome to the ITLS Academy with me Kavita Yadav as a mentor and training coordinator at ITLS Academy. Today's lecture is on based on new topic, that is the nutrition and diseases management. In the previous lecture we have gone through the nutrition, the types of nutrition, what are the components of nutrition, and what are the health related issues about the nutrition. Now in today's lecture I'll be discussing about the nutrition and its role in managing the disease. So let's begin with the introduction. Nutrition is an important consideration when treating certain diseases. This section brings you information about nutritional care and disease with focus on internal and parental nutritional. Nutrition supports for a wide range of conditions such as infectious diseases, cardiovascular diseases, gastrointestinal diseases, metabolic syndrome, and diabetes. Having good nutrition is the best form of preventative medicines to ensure an excellent quality of life in our 70s and 80s age. Okay, what are the research related to the nutrition says about it? Recent research using molecular and genetic information revealed that the nutrients have an impact on our metabolic, genomic, and immune function. Although much of this research is new, the idea that diet has an impact on human health has been here for ages. Fueled by genomic sequencing, the knowledge of medical nutrition therapy has expanded from its effect on evolution to its role in diabetes and heart disease, and now it is leading us to discovering clues for preventing the diseases, for example, the cancer. The newest research in the modulation of immune function by nutrition, which shows the ability to treat diseases like cancer, increase immunity, plays a role in inflammation and to fight against the infection. Nutrients such as the phytochemicals have shown to play a role in preventative medicine. These act as an antioxidant, decrease patients' risk of hypertension, cancer, diabetes, and neurodegenerative diseases. For example, honey is being researched as an anti cancer agent because it has the ability to induce apoptosis and anti tumor properties. So, if we talk about overall, phytochemicals have been showing increasing inhibiting ability related to the carcinogenic, inflammatory, microbial, viral, and aging properties. Okay, let's talk about the chronic diseases. Let me tell you what is a chronic disease. A chronic disease is characterized by a slow progression and it remains for long duration. It includes the examples such as obesity, diabetes, and cardiovascular diseases. So it is undeniable that a well balanced diet goes hand in hand with a healthy lifestyle. What you choose to eat and what you choose not to eat are the factors involving of many leading chronic illness and diseases. So, food choices make a huge impact on how you feel today, tomorrow, and what the future holds in terms of promoting and maintaining the good health in future. So, the right diet can help fight conditions and illness like heart disease, diabetes, osteoporosis, cancer, obesity, and among many others that are affected by these chronic diseases. It may be prevented or delayed with lifestyle changes. Example, healthier eating and more physical activity can even prevent and can reduce the chances of getting ill. So, risk factor includes a condition or behavior associated with an elevated frequency of a disease, but not proved to be causal. Leading risk factor for chronic diseases includes, as I told, obesity, cigarette smoking, high blood pressure, high blood cholesterol, physical inactivity, and a diet high in saturated fats and low in vegetable, fruit, and whole grains, etc. So, what happens when we eat to unhealthy foods, when we take the nutrition from to unhealthy meals, then what happens, we either suffer from such types of diseases. If we are eating too much quantity of food, so we become become disease, we get the disease called obesity. Or if we are taking too much quantity of sugar in our diet, so there will be the chances to get suffer from diabetes. So it depends on our nutrition, that in which quantity and in which way we are taking it. According to the WHO, by 2020, chronic diseases will account for almost three quarters of all deaths worldwide, and that 71% of death due to ischemic heart diseases, and 75% of death due to stroke, and 70% of death due to diabetes will occur in developing countries. The number of people in developing world with diabetes will increase by more than 2.5 fold, from 84 million in 1995 to 228 million in 2025. On a global basis, 60% of the burden of chronic disease will occur in developing countries. These are the data we have collected from the WHO, and according to that, the percentage, the ratio of getting illness from chronic diseases or from unhealthy diet will be suffer from in 2025. Okay, nutrition for chronic diseases and prevention and treatment. Nutrition is a widely accepted tool for prevention of chronic disease. Nutrition is also very important for management and treatment of a chronic disease. Its critical role in nutrition interventions, our lifestyle, and the biological risk factor that contribute to the development of chronic disease. As I told you, that WHO suggested that unhealthy eating diets, physical inactivity, and smoking are confirmed risk behavior for chronic diseases, for getting such types of chronic diseases in our life. So, the biological risk factors include such as hypertension, obesity, lipidemia are risk factors for coronary heart disease, stroke disease, diabetes, etc. And also, as I told you in the previous lecture, that nutrition, the food we eat is consist of nutrition, calories, and different components, which includes the carbohydrate, protein, vitamins, minerals, fats. And if we do not take the proper quantity, if we do not take the proper calories of particular component, then what happen, we do suffer from the diseases. For example, if we talk about the vitamins, if we do not take proper amount of calcium in our diet, then we may suffer from osteoporosis. If we do not take the vitamin D properly, then also we suffer from the osteoporosis. And vitamin and deficiency of vitamin C, deficiency of vitamin iron can also cause the anemia, and deficiency of vitamin C can cause the scurvy diseases. So there are various factors which affects the disease we are getting from unhealthy diet. Taking the first one as the cardiovascular diseases, that is also known as atherosclerosis, the major cause of death or disease of heart and blood vessels, collectively known as cardiovascular diseases, that is in short form we call as CVD. The coronary heart disease is the most common form of cardiovascular disease and is usually caused by atherosclerosis in the coronary arteries that supply blood to the heart muscle. Atherosclerosis is the accumulation of lipids and the materials in the arteries. We also heard about the heart attack and strokes. What is it? The deposit may narrow or block the artery that is present in the inside the heart. These plaques can also rupture, causing a blood clot. As a result, the heart attack and stroke, when atherosclerosis in the coronary arteries becomes severe enough to restrict blood flow and deprive the heart muscles of oxygen, CHD develops. The person with the coronary heart disease often experiences a pain and pressure in the area around the heart, that is the angina. A heart attack occurs. So, dietary strategies are required to reduce this coronary heart diseases. Balance energy intake and physical activity to prevent weight gain and to achieve or maintain a healthy body weight. So, saturated fats, trans fats, and cholesterol. Choose lean meats, vegetables, low fat milk product, minimize intake of hydrogenated fats, limit saturated fats to less than 7% of the total calories. And if you are taking the trans fat to you should take less than 1% of total calories, and cholesterol should be less than 300 milligrams a day. It is the particular criteria used to particular diet used to given to the coronary heart disease patients. Next is our obesity disease. Obesity disease is when a large amount of weight is gained. It is called as the obesity. The imbalance between the declining energy expenditure due to the physical inactivity and high energy diet is the main determinant of the obesity epidemic. Increasing physical activity plus reducing intake of foods high in fat and foods and drinks high in sugar and can prevent the unhealthy weight gain. Taking these simple goals to concrete action requires major social environmental changes in order to effectively promote and support healthier choice at the individual level. If we talk about if we go for a particular exercise uh, that is to reduce the weight, there is three basic component. That is, you have to control on your diet, do your regular exercise, and behavior modification is must in the management of obesity. The general cause of obesity is generally it can be caused by genetic factor, physiological factor, hormonal imbalance, sedentary lifestyle, excess consumption of calorie rich food. If a person is obsessed, it is very essential to know the hazardous consequences of obesity. So by doing regular exercise and control on diet can reduce the effect of obesity. Next disease, if we're taking, that is the diabetes. Let me tell you what is it. Diabetes is a chronic disease that occurs either when our pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. The hyperglycemia or raised blood sugar is a common effect of uncontrolled diabetes and over time leads to serious damage to many of the body system, especially the nerve and the blood vessels. According to the WHO project stated that the diabetes will be the seventh leading cause of death in 2030. Healthy diet, regular physical activity, maintaining a normal body weight, and also avoiding tobacco use can prevent a delay onset of diabetes. So diabetes, as we know, excess weight gain. Oh, the main symptoms is the excess weight gain, overweight, obesity, and physical inactivity accounts for the escalating rates of diabetes worldwide. So diabetes lead to the increased risk of heart disease. Somehow it is correlated with the obesity and also the heart disease too. Kidney disease also can be caused through this. Stroke infections. Increased physical activity and maintaining a healthy weight play critical role in prevention and treatment of diabetes. If we talk about next is the osteoporosis. Osteoporosis of and bone fracture. It is the fragility fractures are a problem of older people. Adequate intake of calcium and of vitamin D in population with a high osteoporosis rates helps to reduce the fracture risk. So does sun exposure and physical activity to strengthen bones and muscles. The next is the dental disease. If we taking caries is preventable by limiting the frequency and amount of consumption of sugars and by appropriate exposure of fluoride. Erosion of teeth by dietary acid in beverages or other acidic foods may contribute to the tooth destruction. Therefore, the crucial role for physical activity as a part of nutrition and health was acknowledged. So, physical activity is a key determinant of energy expenditure and thus the fundamental to energy balance and weight control. The beneficial, if we're talking the beneficial effects of physical activity on the metabolic syndrome, are mediated by the mechanism beyond controlling the excess body weight. So physical inactivity is already a major global health risk and is prevalent in both industrialized and developing countries. So, healthy diet and physical activity are the key to good nutrition and necessary for a long, healthy life. Eating nutrient dense food and balancing energy intake with the necessary physical activity to maintain a healthy weight is essential to all these stages of life. And if we take unbalanced consumption of foods high in energy, that is they are contained high amount of sugar, starch or fat, and low in essential nutrients, contribute to energy excess, overweight and obesity. Therefore, it is required to take a proper diet. Next is the nutritionist and dietitians. What is the role of their? They monitor, access, and optimize nutrition status based on the patient current medical condition. They confer with the physician to coordinate medical and nutritional needs. They make a recommendation for tube and intravenous feeding and or dietary supplements. They teach patients how to make nutritionally sound food choice to speed the recovery process, prevent diseases, and maintain a healthy lifestyle. Okay, you can go through to develop a more personalized nutrition plan with the help of your nutritionist and dietitian. Before deciding on personalized nutrition plan, there are steps every dietitian has to take to make sure that they have all the information. They must collect a medical history to establish the presence of acute or chronic diseases, previous surgeries, or medication use. Suppose if a patient suffer from any diseases, so they must study their history, about medical history. On the basis of that, they decide what type of diet they are required. This is imperative because, similar to how drugs interact with each other, drugs can also interfere with the food absorptions. They also collect anthropometric data, including the BMI, height, weight, nutrition, focus, physical findings. These can be sign of iron deficiencies or other problems. A complete diet history is the last piece of information necessary before administering medical nutrition therapy. With the increasing number of links between the nutrition and disease, prevention or treatment, taking all the right step together, all the information is more important than ever. Okay, what is a therapeutic diet? As told in the previous slide, a dietitian often recommend a therapeutic diet. These diets are a special diet developed to treat disease or any metabolic disorder. These diets includes the regular diet. Regular diets such as regular diet is refers to the balanced diet. At time, it has a slightly reduced caloric content. Foods such as rich dessert, cream, sauces, salad dressings, and fried foods may be decreased or omitted. The next is the liquid diet. Liquid diet is nutritionally inadequate and should be used for short period of time. It is liquid diet is generally used when patient have gone through a surgery, or after it is used after surgery or heart attack, patient with acute infection or digestive problem. It is also used to replace fluid lost by vomiting or diarrhea, and before some you are going through x-rays or digestive tract, then there you are recommended with the liquid diet. Next is your soft diet, similar to the regular diet, but food must require a little chewing and to be easy to digest. In this, you have to avoid meat and shellfish, coarse cereals, spicy foods, rich dessert, fried fruits, raw fruits, veggies, nuts, and coconuts. The next is the diabetic diet. Okay, diabetic diet is used for the people whose body does not produce enough insulin to metabolize the carbohydrate. So they have to avoid sugar, heavy foods such as candy, soft drink, desserts, cookies, syrup, honey, jams, and jellies. The new trend is to count only carbs since blood sugar level are most affected by the carbs. The patient then takes an amount of insulin based upon the amount of carbs eaten. Next is the your calorie control diet is somewhat similar to the regular diet, that is the balanced diet. Low cholesterol diet is required for the obesity patient. Fat restricted diet, sodium restricted diet, let me tell you, low sodium or low salt diet. It is used for the patient with the cardiovascular diseases such as the high blood pressure and congestive heart diseases or kidney diseases. Here you have to avoid or limit addition of salt to any food. Avoid smoked meats or fish or processed food, pickles, etc. High protein diet or protein diet refers to the use for children and adolescents who need additional growth. Also required for the pregnant women, patient before and after surgery, patient suffering from burns, fever, infection. These patients requires the high protein diet. Regular diet with added protein rich foods such as meat, fish, milk, cheese, eggs contribute to the protein diet. Next is the low residue diet. These are somewhat balanced. Your balanced diet is also only. So I hope you have understood all the nutrients related problems and their deficiency diseases. For more information, please log on to our website and follow us at Instagram, Facebook, Twitter, LinkedIn, WhatsApp, and yes, do follow us on ITLS Academy channel at YouTube. Thank you for being with us.